So I'm not going through details. I'm just going to talk about a general rules or a general guidelines before, during, and after applying for CESR in regards to ophthalmology. And if it's the same, I think this will apply for all the other specialties. So before starting, you should know it's not an easy process. So if you have a possibility, from my point of view, if you have a possibility of joining a training job, which will end up by definitely going with a very high success rate, definitely reaching the consultant registration in the GMC, you should consider it. So it's not an easy escape or an easy way to reach the consultancy level in UK. Before we start, you have to read carefully the GMC and the Royal College guidelines many times, as much as you need to not to be lost or to do the same mistake that everyone else had. One more thing is, I do not believe, from my point of view, that you can do it by yourself unless you're extremely lucky. So the group support is mandatory. We do have a lot of groups, whether on WhatsApp, Instagram, Facebook. We have a lot of groups that can support, that can tell you what you're doing right or wrong, motivate you, try to push you forward if you are lacking of interest or you're demotivated. So, as I said, if you have a training post, consider it. Very few gets it from the first time from the ophthalmology point of view, but according to the statistics, it's like 50-50 from what Dr. Ahmed just said, and it's getting higher. Just one more thing that came to my mind, Dr. Ahmed, you did share one slide. So if you reappeal, that means that the success rate is higher or lower? I didn't get that slide.
No, essentially, going down the route of the appeal is probably less likely to be successful because you are not appealing against the clinical evidence. You're appealing against the structure of or the process of the application, which they usually get it right. So you can't really challenge the clinical decision unless you really had very strong evidence. So what I meant by the success rate for reapplication is that you have something missing in your application, and they will tell you what you need to do before you reapply.
That's very good. Yeah, this is a very important rule, because most of the applicants that they fail to get it from the first time, they get some advice from the GMC, you're missing this and that points. So if you do that, you might be very lucky of getting it from the second time.
Yeah.
Okay.
Exactly.
Yet from some of us who are considering the CESR, it's the only pathway of getting the specialist registered in the GMC. Like for myself, I'm 46. I do not wish to go through the training process again. I do believe that I do have a lot of evidence throughout my career, especially in the last 5 years, to cover most of the point, if not all, that's required in the CESR. When you apply, one of the tricks is to think like the assessor, as Dr. Ahmed said, how he will look into my application. So generally speaking, if you're a surgeon, you should know what you're doing regarding the surgery or the clinical exposure, and you have to prove that you're doing it and how you're doing it. So it's not just I'm doing like this kind of surgery and I can give you my logbook. No, you have to, like most of us as Egyptians, we think that we're seeking perfection, which is not true all the way. We do mistakes, and if you do not proof that you did have some mistakes or some complications, that means that something is wrong, something is fishy. If you are a surgeon, you'll know what I mean. So no surgeon didn't face any complication throughout his career. Complications happen. It's one of the requirements in your application to document these complications and how did you manage it. And it's not only about the surgical or the clinical exposure. There's a lot of other points that usually we do not expose or think about during our practice in the Middle East in general, like how to prioritize your tasks, how to involve the cost benefit in your decision, the research, the personal health. Are you taking care of your own health prior of taking care of your patient's health? The community services. Are you participating in community services, the volunteering? And are you improving the job, the quality improvement, the audits, which is one of the most important points and was detailedly discussed in the previous talks. Keeping the patient's confidentiality, which is, if you talk about that in front of one of our colleagues that have been practicing exclusively in Egypt, he will just make a laugh out of you. They don't think about the patient's confidentiality. The compassion, showing compassion, and how to communicate, which was also described before. During your application, which is a very long, by the way, one of the questions that came to my mind, you talk, Dr. Ahmed, how long did it take you to get your CESR? You joined in 2009, the UK service, and then you got it in 2019.
Yeah.
So 10 years.
So, yeah.
10 years.
But yeah, so the application process itself, it took about 1.5 years because I had to reapply, so I didn't get it from the first time. But gathering the evidence took me quite a long time. But to be honest, I only started thinking about it 3-4 years down the line. So you know, initially when you come, you're not really sure what you're going to do, and then you in this situation for 3-4 years, and then you realize that, okay, what I'm doing. So let's start gathering the evidence. And bear in mind, intensive care at that time wasn't a specialty, so there was no kind of intensive care specialty. It came in training in 2011. So I was kind of gathering something that I wasn't sure whether this is going to be the right evidence that's needed or not. So this is the point from my specialty. So it's not the same for everyone, because
exactly
the rest of the specialties are kind of more well established, and you know exactly what you need to do. So that's why for me it was a bit longer than it should be.
This is exactly what I'm getting throughout my colleagues in ophthalmology. For example, the average time that takes them to gather the evidence, not to submit it, for like 4 to 5 years, which is not small time. That if you do have the motivation and the enthusiasm to go forward, some of them not very much, but some of my colleagues did give it up. So they started and then they said, no, I'm working as a specialty or a locum consultant. I'm going to continue doing the same. I will not have this burden and the stress of collecting the data, and they lose interest at the end. So if you're planning to start the CESR application, just bear in your mind, it's not a short duration. It's not an easy process, and you should have a plan. One of the very interesting topics and advice from one of my colleagues, that every day take a little bit small steps. So you go to your job today, putting in your mind that I'm going to collect this data today. These 2 documents, I'm going to just fill it, sign this work-based assessment or surgical skill, whatever. So just take it one very small step at a time, and do not look at the end. So I'm going to show you at the end of my presentation the how many boxes that you need to tick. It's a lot. If you take a look at that box as a whole, you will give up, but don't do that. And also don't have a risk. So don't say to yourself, okay, I'll take like a 2-month vacation from CESR and just have a peace of mind. Don't do that. These 2 months is going to end up by 2 years. And as I said, join a group. These are the links for the GMC guidelines for the CESR, and that one for the Royal College. That's my email if anyone is interested and want to ask more questions. But let me show you about the ophthalmology. If I can just escape this one. So for example, this is, I'm not sure if this is showing or not, this timetable, table. Is this showing?
No, we can just see the last slide of your
last slide in the PowerPoint. Okay, so never mind that. It's just a huge box and a huge things to take, which I don't look at. So just bear in mind to take a very small step at a time.